Welcome to a virtual town hall meeting, opening West Virginia. Here's Mark Curtis.
And good evening, everyone across the mountain state of West Virginia. Thank you for joining us. I'm Mark Curtis. For roughly 2 months now, the coronavirus epidemic has drastically disrupted our lives. A stay-at-home order closed businesses, thousands of jobs were lost, as well as income, and the state lost hundreds of millions of dollars in tax revenue. It's been a historic crisis, but now the pandemic appears to be easing in West Virginia. Over the next 60 minutes, we are going to speak to the experts from around the state in government, business, medicine, and tourism, amongst others, to get an idea of what is opening and how opening West Virginia is going to take and build our future. So, the plan to open West Virginia. Well, joining us now is Governor Jim Justice, Democratic U.S. Senator Joe Manchin, WVU Business and Economics Professor and the Research Director as well, John Deskins, Ph.D., and District 3 Republican Delegate Erica Storch, who is also President of the Wheeling Chamber of Commerce. I want to begin with Governor Justice. We've had this partial phase-in reopening of the state government. We've seen outdoor restaurants open, elective surgeries, haircuts are back on the table. The big date on the calendar everyone's talking about is next Thursday, May 21st. Tell us what's going to happen and what the significance of that is. All right, I was going to warn our viewers as we start, we are going live to about 14 different remote locations around West Virginia, and so there's going to be a delay in some of the signals. Don't worry, nothing wrong with your TV, but we'll get the answer to the governor from the governor in just a second. I want to check in with U.S. Senator Joe Manchin, who joins us from Washington, D.C. Senator Manchin, we hear discussion of another round of stimulus. Speaker Nancy Pelosi proposing another $3 trillion in benefits that would be sent out to the states and individuals. Do you support this? What should we be doing that we haven't already done in Washington? And good evening, Senator.
Good evening, Mark. How are you? Can you hear me?
Good. Hear you just fine. Go ahead, sir.
Okay. It's an 1,800-page bill, which we're going through it. My staff has all been dissecting it for the last 2 days, so we really don't know exactly everything that's in it. But I can tell you $3 trillion, that's a big lift right now, and I don't think that's going to go anywhere in the Senate. The thing that I'm concerned about is we get back and trying to get back to normal and help us come out of this economic downturn that we have right now, but also be safe. The most important thing is to be safe. So everything that we should be doing should be around the COVID virus. Are we doing anything enough with the National Institute of Health, Centers for Disease Control, making sure that we have a handle on this as quickly as we can to get.
All right, again, a little bit of a technical. There we go. Go ahead, Senator.
That we don't have a return of this, or another pandemic will come behind it, or it has a resurgence next fall. And the whole thing, getting back to normal, you need to test, trace, and test some more. So if you're testing people that are going back into the workforce, then they should know, is it going to be safe? Is my colleagues and my fellow workers, are they non-infected? And then if something does have an outbreak, there should be tracing set up to where we can trace everyone who's had contact with that person and test them too, so that we can shut down any outbreak or have it basically infected other people. So there's so much that needs to be done, and I cannot, for the life of me, understand why the president hasn't invoked the Defense Production Act for any manufacturing in the United States of America that can provide the testing and all the necessary supplies for testing, and also basically for all the PPE. The personal protective equipment. We've got people that we've been talking, our staff talks to people every day. We've talked to all 50.
All right, Senator, we'll come back to you about this because I know that we're going to talk to some medical experts shortly about the testing issue, so we'll get back to that. I want to kind of drill down on this. He's speaking on a national level. Let's drill down to the local and state level. Delegate Erica Storch, Republican of Ohio County, joins us now. And Erica, you wear two hats. You are a member of the House of Delegates, but you're also the president of the Wheeling Chamber of Commerce. Talk to me first about what needs to be done to help the business community, particularly small businesses.
Good evening, Mark. So, yes, you're correct. I do wear two hats, and those have been two interchanged hats a lot in the past few months. And, it's been trying for our small businesses and our local businesses who employ so many of our friends and colleagues and constituents. So right now, I think one of the best things that could be done today was the SBA coming out with their good faith definition for those that receive the PPP loan of less than $2 million, which will help them have some reasonable assurance that that loan will be forgiven. Excuse me. And so that was huge for them, in my opinion. Additionally, we need to get out and support our small businesses and our local businesses as best as we can, whether it be get takeout, buy gift certificates, whatever. We've seen a lot of creativity in the Wheeling area and within our chamber members. They've been coming up with all kinds of incredible creative ways to keep providing their product and services. And so I think we just need to embrace them and support them and realize that they are the backbones of our communities.
It's almost like the shop local effort we see around the Christmas holidays. I want to come back to Governor Jim Justice because we have fixed our audio problem here and talk about the big picture, Governor. As I mentioned earlier, we've opened restaurants to outdoor dining and takeouts. We have haircuts available now, outpatient surgeries at hospital. But I think you're looking forward to the next big day in all of this, Thursday, May 21st, when a lot of big items open again in the West Virginia economy. Talk about that.
Well, Mark, that's right. We're going to have indoor dining. We're going to limit it to 50% capacities. We're going to have our box stores open and open up in our retail. Our Hatfield and McCoy's trails are going to be open, and our campsites to our residents in West Virginia are going to be open. And so there's a lot of different things that are opening up. But I caution everybody, as I've done this all along, we have truly seen a miracle in the state of West Virginia. We're right in the hotbed of everybody, and everybody around us is multiples more in deaths and more in positives. We have done this as West Virginians, all pulling the rope together. We haven't done this as Democrats and Republicans and independents. We've done this as West Virginians, pulling the rope together, and we've produced something that's unbelievable. So we've got to continue just that. Baby steps before we run and everything. And we've got to monitor and absolutely continue to do everything and push everybody in the right way. We've done good stuff with our nursing homes, first in the nation. We've been first in the nation on a whole bunch of things, but we need to be first in the nation running across the final finish line.
All right, you mentioned the great people of West Virginia, Governor. We're letting them participate in this show, too. Sherry Blue, who watches us on WBOI TV, asked this question, quote, the governor has mandated all nursing care facilities be tested for COVID-19 because the elderly are at high risk. People who have autoimmune diseases are also at high risk. Why aren't these people being offered tests as well? Again, the governor, if you could address the issue of people with autoimmune diseases and whether or not they should be given tests as well.
Well, Mark, if I heard correctly, it's Shelley. It's just simply just this. They do need to be tested. And the bottom line is just this. We have continually struggled with a limited amount of testing capabilities and everything. And as we grow more and more and more, we'll be able to address and attack more and more issues that you're referring to exactly there. From the standpoint of first it was the nursing homes, then it's assisted living, then our minority groups. There's so many, our daycare centers and everything. There's so many different areas that we need to test, and the more we can test, the better off we'll be. I agree with you 100%, and all of our experts are trying to do everything within their power to get to exactly what you're referring to.
Let me ask the question, too, to Senator Manchin, because I'm curious about the next round of funding from Washington, D.C. Are we going to see enough money for testing, supplies, equipment, PPE, all the medical things the governor says we still need that we don't have enough of?
It'll break. Okay, absolutely, Mark. There's an awful lot of money been put towards it already, and there's a lot more that's coming that way. The bottom line is that President, we're still urging him to do the Defense Production Act, making sure that every manufacturer that has a capability of producing the amount of testing that we need, millions and millions and millions. In West Virginia, I think the governor would know this, we've tested 67,000 people out of 1,800,000 people. If you're asking people to go back to work, they want to be tested. If someone breaks out and has a confirmed case and a new open business, or business is just trying to open, they want to make sure that basically there's tracing. And it's going to take an awful lot of testing for people to feel comfortable. So we need to do all we can. There'll be a lot of support coming to the state, revenue coming to the state, and putting basically a coronavirus task force together to see how this money can best be used in the communities, in the municipalities, in the counties. Those are all things, and the state needs to have flexibility and backfilling. We're working on that. And also on the PPPs, Mark, I introduced a piece of legislation that gives from 8 weeks to 16 weeks forgiveness, because a person doesn't make any sense. They get a loan, they're keeping people on the payroll, they've got no business because they had to close down, and then they get at the end of 8 weeks, they start to open back up, they lay everybody off because there's not enough business. Made no sense at all. I think this is going to be a bipartisan, it's accepted by both sides, and it's a good fix. We think it'll help an awful lot of businesses, help a lot of their employees stay employed and get a paycheck.
Hey, let me check back with Delegate Erica Storch, because you got your fingerprints on this too. What can the legislature do? Do we need to have a special session, and what can the House of Delegates and Senate do to affect change in this crisis, Erica?
So the House and Senate members that I'm familiar with and have been speaking to frequently have been having conversations with all of our leadership teams downstate and around the state, and we've been communicating with the governor's cabinet to connect people that are having issues with or questions, just connect them with the department heads and the governor's cabinet secretaries to address those concerns. I mean, we probably will need to go in, but we could probably go and handle it at a regularly scheduled interim. And I mean, obviously the governor has some flexibility to move some monies around, and I mean, obviously there will be supplementals that'll be necessary to help with fiscal year 20, which will be ending here shortly. But I mean, I think that the way that the governor and his team have been handling it have been very appropriate and very prudent. And, you know, like I said, they're keeping us up to date. They're keeping us up to speed with what's going on. So I think everybody feels like we have the best information we can.
All right, Delegate Storch, thanks. Let's take another viewer question. Linda Jones, who watches on WOWK, has a question about mask usage in public. Why hasn't the wearing of masks in public spaces been made mandatory until a vaccine is created and available to every person in the state? And I guess I'll toss that out to Governor Justice. Should you be making mask usage mandatory in the state of West Virginia, Governor?
Mark, I don't think so. And the reason I don't think so is just this. You know, I want to encourage everyone, and absolutely, if I'm out and you know, I'm going to wear a mask. And I am telling everybody to wear a mask and everything. But at the same time, you know, we've all got to understand, how did we get to where we are today? And the way we got there is we all came there together. Now, at this point in time, our numbers that we keep kicking out are fabulous, and that's all there is to it. We're going to watch in every way, but I don't want to divide us. I don't want to have a section of people and everything saying, well, I'm not wearing a mask no matter what anybody says. And before you know it, we're fighting amongst ourselves, and our numbers are too good right now to be fighting amongst ourselves and everything. If our numbers start to drift and we need to make our masks mandatory, I'll be the first one to do it.
We want to thank Governor Jim Justice, Senator Joe Manchin, and Delegate Erica Storch for joining us in our first segment. Coming up on Opening West Virginia, we're going to focus on West Virginia's economic recovery. The COVID-19 pandemic derailed the Mountain State's economy, throwing tens of thousands out of work. What's it's going to take to get business back, big and small? We'll be right back with that.